Rotator cuff injuries are quite a common type of injury of the shoulder girdle. In today's video, I am going to tell you what is this rotator cuff, how it gets injured, and we will go over a couple of tests for the rotator cuff injuries which may help pinpoint if you really do have a rotator cuff issue. A shoulder joint is one of the most complex joints of the body. It consists of a lot of tendons and muscles which work in sync to help move the upper arm through an incredibly wide range of motion. You can try this for yourself and you will realize that the upper arm can move practically in any direction possible. The head of the humerus is the large bone of your upper arm which rests in the concavity of your scapula to form the glenohumeral joint. It is this joint which is responsible for the range of motion. The scapula is a trapezoidal shaped bone of your upper back. Please note, I may be oversimplifying things in this video for the sake of helping you understand a little bit of the anatomy of your shoulder joint. The shoulder joint is surrounded by muscles. The uppermost layer of muscle is what you see beneath your skin, and it is the deltoid muscle, or more commonly known as the shoulder muscle, and the muscles of the upper back at the rear. Now beneath these muscles lie the muscles of the rotator cuff. These are really four muscles named the supraspinatus, the infraspinatus, and the teres minor, which lie on the posterior side of the scapula, and on the anterior side is the fourth muscle, the subscapularis. You will notice that these muscles are actually very deeply set, and at the same time, I hope you can appreciate how complex the shoulder joint really is. Remember also that every muscle is inserted into the bone via a tendon. The function of these four rotator cuff muscles is to hug the bone of the upper arm and pull it into the socket of the scapula, and at the same time help with some basic movements. To be more specific, the supraspinatus helps with the abduction of the upper arm. The infraspinatus and the teres minor help with the external rotation of the upper arm, and the subscapularis helps with the internal rotation and adduction of the upper arm. A lot of things can cause rotator cuff injuries. They most commonly occur in people who do a lot of work with their arms raised, such as construction workers, painters, and teachers. In teachers, it is generally the right arm if they are right-handed, as they use it to write on the blackboard. It could also be a result of an injury while playing a sport such as tennis, badminton, or bowling in cricket and baseball, where your arm is raised and it comes down with force. It can also be a result of training in the gym with improper form, such as flaring your elbows while pushing your weight. The tendency of the rotator cuff injuries has also a very strong genetic predisposition. The rotator cuff pain could be because of a strain to one of its muscles or an irritation or tear to one of its tendons. This tear could be partial or it could be complete. The pain in the shoulder area could also be due to inflammation of the synovial sac just beneath your collarbone and above your scapula. This type of structure is called a bursa. To diagnose bursitis, you may run your hand along your collarbone until you find a sharp point, and then come down a bit and rub and press hard. If you get pain, it could be bursitis. It might be difficult for you to find this region at first, but with a little bit of trial and error, you might find this spot which is tender. Tendonitis may also occur in this area. You might have heard it more commonly being referred to as impingement. If you notice, the shoulder joint is a very compact joint with a lot of structures running through it. If your shoulders are rotated forward, either due to bad posture or due to some exercise you're performing incorrectly, it may result in your tendons rubbing against the surrounding structures and getting irritated and giving you pain. You could perform a couple of simple movements to check if you have a strained rotator cuff. Depress your shoulder down and lift your arm like so while providing resistance with your opposing arm, and check if you are getting pain. Alternatively, bend your arm, place it on the opposite shoulder. Cup your elbow and push it up slowly, checking if you are getting pain. If you get pain with these exercises, it could be an injury to the supraspinatus, which is quite common. Remember though, these tests are only very simple tests and are by no means a comprehensive method to diagnose your problem. Use these only as indicators. Do visit your doctor for a thorough evaluation. If you have pain in the shoulder joint, the best thing you can do is rest. If the pain is unbearable or is causing you disturbed sleep, contact your doctor and he will prescribe you anti-inflammatories. Icing will also help relieve your pain. At this point, your doctor might decide that you need an MRI to confirm the diagnosis and find out exactly where and how severe the problem is. If the pain does not subside, your doctor may have to give you some injections to relieve the pain. In the long term, however, depending on the severity of your injury, you will have to work on strengthening and rehabilitating your shoulder joint. But better still is to perform a few prehab exercises for your rotator cuff even before you get injured. Injury to this area sometimes is inevitable if you are training hard due to the complexity of the joint, and prehab is an absolute must. Coming up soon, a video with prehab exercises for your rotator cuff you can do at home. So subscribe first to not miss out. Like, share and do some YouTube stuff. Signing out, Dr. Rohan Fonseca.